Hi, my name is Carolyn Haire, and I am going to be doing my head and face and neck assessment for my health assessment class. Prior to doing an assessment on a patient, there are certain things that you want to make sure that are always in good standing. You want to make sure that your hands are washed, that you have all the supplies you need, and that the lighting is adequate. I have done all those things. I have my supplies. I've washed my hands. And my light is turned on, and I'm ready to introduce myself to my patient and begin my assessment. So with that, I'm going to get started. Hi, Sarah. Can't see. There we go. Hi, Sarah. My name is Carolyn. I'm going to be your nurse today, performing your head, face, and neck assessment. How are you doing?
Doing well. How are you?
I'm good. So as I walk into my room, I'm already examining and assessing her clothing to see if her clothing is appropriate for the weather. I'm assessing her affect, her level of consciousness, her posture. I'm assessing her hearing. Is she able to hear me when I'm speaking in a normal tone? I'm also assessing her speech. Is her speech clear and understandable? I'm also noticing if she has any physical limitations or problems that are noted as I went enter the room. Her hearing is good, her speech is clear, so I'll start off by, like I said, introducing myself, which I already did. And I need to know, Sarah, can you tell me your complete name, your date of birth, and where you're at?
Sarah Haire, July 20th, Mercy Hospital.
Okay, perfect, thank you. So with that tells me that she is oriented to person, place, and time. So with any exam, you always start off with a visual inspection. I'm going to work my way from top to bottom, so I will start off with her head and her face. Her face, or her head, I look at her hair, her cranium, her scalp. I note if there's any hair thinning, patches of hair that are missing. But as I can visually tell from looking at her hair is clean. Her hair is thick. I see no patches or hair thinning. I also noticed that her scalp is symmetrical and it appears normal. With that, I'm going to start my palpation. Is it okay if I touch you, Sarah?
Mm-hmm.
Okay, I will start by palpating her scalp. Any tenderness with any of that, Sarah? And I work my way down all the way back and finish at her occiput. No tenderness?
No.
Okay. So that's all good. And then I'm visually going to inspect her face. I see that her face is symmetrical. Her eyebrows are symmetrical. Her eyelashes turn upward. Her eyes, she has no active drainage. No lesions, no moles, no lumps or bumps that I visually see when I look at her face. So next, then I want to palpate her for her temporal artery. As I palpate for her temporal artery, I notice that her pulses are strong and equal. And then I work my way down to her temporal mandibular joint. And I say, I'm going to have you open your mouth. Do that twice. And while she's doing that, I'm assessing for any clicking or pain with that, and none of that is noted. So that part of my assessment then is complete, and I will move on then to her eye exam. With her eye exam, again, you want to start off with inspection. So you visually inspect the eye. You do that by looking at her eye, and I will go ahead and obtain my light source. And with that, I'm just essentially looking for any foreign objects. I'm making sure that the cornea is clear, sclera is nice and white, and I don't see any foreign bodies, and it looks nice and clear. So the first thing I want to do is check her peripheral vision. And again, the way I do that is I'm going to step a little closer to Sarah, And Sarah, when you see my fingers, I want you to let me know when you see them, okay? This is called the confrontation test.
No. No. No.
Perfect. Thank you, Sarah. The next thing is we want to test her extraocular eye muscles. There's a few tests that we can do to do that. One is where we test by having her cover her eye with an opaque piece of paper and have her focus on my nose with the eye that is uncovered. As she does that, I notice that her eye is focusing on me. I notice no movement. She's looking at me clearly. Then I would have her remove the paper from her other eyes, and I notice that and have her continue to look at me, that the other eye that she just removed the paper from is not wanting to rapidly correct and pull it into view. It's nice and relaxed and not trying to compensate for the other eye. And then you would repeat that with the opposite eye by having her cover it. And all that was good. That was normal exam. The next thing is I want to check her corneal reflex. And again, I'm going to get my otoscope. And I'm going to turn my light on. And I'm going to have her essentially look at my nose. And I'm going to shine a light into her pupil. And I will see the corneal reflex as the light shines in her eye. And when I do that, you'll see that the light in both eyes bilaterally, and I did that when I shined the light, and that was normal. The next thing I can assess, since I already have my light source out, is actually her what we call perla. Pupils equal and reactive to light is what we like to see, reactive to light and accommodation. So the way I would do that is I would bring my light source in from the side, and I would look, as I'm shining the light, I would look at her left eye. And I notice that her pupil is brisk and equal and reactive to light. I will bring it in one more time, and I shine it into the left eye, and I look at her right eye, and I notice also that her right eye is equal and reactive. That is essentially my accommodation. So I would repeat that on the other side. Perfect. And again. And so both pupils are equal and reactive to light and accommodation. I would continue then with assessing her eyes, and I would want to pull down on the papillary conjunctiva, and I notice that the conjunctiva are light pink, her scleras are right, I see no yellowing or discoloration, her pupils are round, and there is no active drainage. The other thing that we would be assessing is we have all patients do the Stellan test, which is a visual acuity test. In order to do that, we have the patient stand 20 feet away from the eye chart. And as she's standing 20 feet away, and if she wears glasses or contacts, she leaves those in place. She reads the lowest line on the chart with one eye covered. And then changing eyes, she covers the other one and reads it again. And then she repeats that with both eyes uncovered, using both of her eyes. The other thing that we want to check as far as extraocular muscles is what we call the six cardinal positions. And the way I do that is essentially I have Sarah, I'm going to have you look at my finger. And I want you to keep looking at my finger and follow it without moving your head. I'm going to have you go. Perfect. Back to midline, lateral, up, and down. Perfect, Sarah, thank you. The other thing that I can do when I'm checking this is her convergence. So I'm going to have you follow my finger into your nose. And I do note that both eyes converge. That usually will happen anywhere from like 5 to 15 centimeters away from her face. As I'm doing that, you can also check, as she's looking at my finger close up, that her pupils are constricted. So I'm going to have you look at my finger, but then I want you to look at the wall behind me. And you note that her eyes dilate as she looks farther away. With that part of the eye exam finished, then we go on to the next part. Oh, I'm going to back step one thing. We're not doing a fundoscopic exam for this exam, but I do want to explain the red reflex. So essentially, you would get your otoscope, your ophthalmoscope, excuse me. And I know we're not truly doing a complete fundoscopic exam, but you would, when you're examining for the red reflex, you essentially want to use your right eye when you're examining her right eye. And the way you do this is you want to look at the pupil of her eye, and once you find the red reflex, looking at her pupil, then you want to follow that in. And as you get closer, you're following that red light back through her pupil and assessing her blood vessels and her optic disc. And you would repeat that on both sides. So now we're going to move on to the next step of the assessment, which would be her ears. So again, you want to start off by visually inspecting her ears. You want to look for any redness, any inflammation, any drainage, any crustaceans, any lumps or bumps or moles. And I don't see any of that with either of us. The next thing, before you actually you get your otoscope and examine her external ear canal, is you want to do the tug test. Here, does that hurt at all? No. And then you want to do a whisper test. Sarah, can I have you occlude one side? And I'm going to say a word, and I want you to repeat it back to me.
Apple.
Baseball.
Baseball.
Perfect, thank you. So then I'm going to go and proceed with my examination. I'm going to look into her external ear canal and also assess her tympanic membrane at that time. So I've already gotten my speculum placed on my otoscope, and I'm going to place this into her ear. And the way you want to do this on anybody over the age of 3 is you want to pull up and back. If they're under 3, you want to pull down and back. So I'm going to head and pull that up and back and assess her external ear canal and follow that through to her tympanic membrane. Her tympanic membrane is pearly white, as it should be. What you're looking for, what would be concerning, is if it was bulging or if it was red or if you could actually see any drainage back in there. And then again, I'm going to repeat that. And again, her tympanic membrane is pearly white. Her external ear canal on both sides is clear. I see no redness or inflammation. That makes the ear exam complete. So I'll move on now to her nose. So once again, I want to visually inspect her nose. I see that her nose is symmetrical. I don't see any deviations to either side. I don't see any sores or drainage outside of her nose. And so then I would go ahead and visually get my otoscope again with my speculum to visually inspect the inside of her nares. I'm going to have her tilt her head back. And when I insert my speculum into her nose, I want to be sure that I don't go too deep. Really, you don't want to go past the turbinates, excuse me, because the nose is very vascular and you can cause irritation. So I'm going to put this at the tip of her nose. I'll be assessing her turbinates, her septum. I'll be looking for any nasal polyps and any drainage. I don't see any drainage. I don't see any polyps. Her septum is intact. So then we will move on then to her mouth. With her mouth, you want to start off again once with a visual inspection. You want to assess her lips, see if they're dry, cracked, bleeding. You want to look for any sores, any hepatic lesions, any problems in that way. Her lips are nice and pink, they're moist, they're intact, so then I would have her open her mouth to do the internal visual exam. First thing first, I'm going to have you, Sarah, just open your mouth and let me look. And can you say, ah? Ah. And as I'm doing this, I'm looking at her soft palate, her hard palate, her dentation, her gums, her oral and buccal mucosa, and her tongue. Can you lift your tongue for me to the roof of your mouth? And when she does that, I also look at more dentation. I can see the ducts below her tongue, and that is all nice and pink. As I was doing that, when she said ah, I could see that her uvula moved up. I could see that her tonsils were like a +1, which means they were visible. Stage 2 for tonsils would be that they were between the uvula and the tonsillar line. Stage 3 would be that they were touching the uvula, and stage 4 is that they're touching each other. The next part is I actually want to put a glove on, and I actually want to palpate for any induration or tenderness. Any tenderness, Sarah? And that all feels fine and looks good. So then I'm done essentially with the oral exam, and I move on now to the neck exam. With the neck exam, once again, I want to start that with an inspection. So essentially, I want to look at her. I want to look for any lumps or bumps or nodules. You would also, if she had a goiter, you would probably visualize a goiter at this point as you're doing your visual exam inspection. I see no lumps or bumps. Her trachea is midline, and everything looks to be in place. So I will start off with my palpation, and I'm going to actually feel for her trachea. And I'll actually use my right hand to displace it slightly as I feel for any lumps or knots or nodules. And the same on the other side. And I see no lumps or bumps or nodules. So then I will go on, and then it'll be I need to assess her thyroid. Though one of the better ways to assess for the thyroid is from the posterior angle, so I will have Sarah turn that way to face the camera. And I want to come behind her, and I want to feel for the cricoid cartilage, and have hands on both sides. And Sarah, I'm going to have you swallow. And as she swallows, that brings the isthmus forward to where if there was a thyroid nodule, you would feel it at this time. I do not feel her thyroid, so that is normal. Next, I want to assess her range of motion. Sarah, can you tuck your chin to your chest? And can you look to the ceiling? And touch your right ear to your shoulder and your left ear to your shoulder. Perfect. Push against my hand and push against my hand, and I'm assessing the strength of her neck essentially with that. Next, I want to assess her lymph nodes, and the way you do that is you use your 2 or 3 fingers, and you move them in a circular motion, and you start pre-auricular, and you work your way around post-auricular, tonsillar, submandibular, submental, and then anterior cervical, posterior cervical. Deep cervical lymph nodes, you actually have to have them rotate their neck to the side. Those are deep, and you won't feel them unless you have them rotate their neck, and a lot of times you won't feel them anyway, but you do want to assess for that. Then you want to go supraclavicular, and occipital. And I feel no lumps or bumps or nodules. With lymph nodes, if they are tender, large, not movable, those are all signs of possible concerns, maybe doing a little further investigation. That pretty much sums up my exam for the day. I hope you enjoyed this assessment, and have a good day. Thank you.